it's been a long time since I've made any content. I used to be a content creator for health and wellness products, and before that I was a chef, and then after that I became a J.S.C certified health and mindset coach, and had a couple kids in between there. Got back into acting a little bit, which has been really cool because that was my sort of dream ever since I was a kid. But as I'm sure a lot of you know, sorry, that's Arlo's butt tail, our dreams sort of slip away from us, and we kind of get lost as we age. Anyway, so why am I here? Well, I've always been so passionate about food for one, but like whole natural foods, healthy foods. I still love the junk food. I have my things, like I love Doritos, or I don't know, I have my weaknesses. But I've been going through this interesting health journey, and it's been interesting, it's been enlightening, it's been very frustrating and infuriating, debilitating at times. And I feel like I need to bring awareness to it for women and for men, and sort of bring a voice to women's health, women's hormones, specifically in regards to menopause. So for the last, I don't know, I kind of forget how long it's been, let's say 2 months, maybe a little longer. Arlo, please don't do that. Hey. Okay. He's trying to get comfortable. I've been dealing with vertigo. It just sort of subtle vertigo that wasn't debilitating or anything. I was still capable of driving my kids around and going to do the groceries and all the things. We even traveled while I had it, and like I was aware of it, but it wasn't concerning for some reason, I guess because I could still function. And about a month after that, can you stop messing up my bed? My dog has anxiety. I'm not surprised. All my dogs have anxiety. God, dude, trying to focus. About a month after having vertigo, I started getting hot flashes. Not overly sure at the time if they were related, but basically I was due for my annual checkup with my doctor, and they had called to schedule my blood work, and I had asked her to please check my hormones, my estrogen, my testosterone, and my progesterone, because specifically the hot flashes, right? And she did. And I want to be very careful about what I say about healthcare, because it's really at no fault of their own that there's not much awareness or knowledge about menopause. Some specialists, OBGYNs, and some GPs, and some other specialists, and maybe naturopathic doctors and stuff like that, do the extra research and have more knowledge about menopause. My doctor didn't seem overly concerned, and wanted to put me on some evening primrose oil that could maybe help with the hot flashes. Now, by this time, I had already, for some reason, and I guess I know now, been listening to podcasts and doing my own self-learning and research about menopause. I don't know why, but I guess I was guiding myself to prepare myself to go through menopause. menopause, because apparently I'm in it. I'm in the thick of it. Even potentially postmenopausal, which is insane. I'm 44, so to some people that's surprising. Some people think that's young, but I feel like I don't think it is young. I think it's the same with the internet, right? Like, we don't know if something's been happening all along or we think it's happening more. I think it's just because no one was talking about it and because there was no social media. Now that there is social media, people are talking about it. It seems pretty common that a lot of women go through menopause around this age, even starting as young as 35. And looking back, I think I had symptoms looking back. Things like very, very low energy, chronic constipation, mood swings, and what else? Last year I had a couple episodes of like a hot flush. Like, it was almost like allergic reaction or something. All of a sudden I was hot and visibly red, as if it was like an instant sunburn, and it lasted for a few minutes and then went away. That happened to me twice last year. Didn't look into it, but I think I've probably been going through the symptoms for quite some time. So vertigo, which I've been told is not common. It is not a typical side effect, symptom of menopause. But from my self-learning and research, I'm thinking that it probably is. And a little further research shows that we do have estrogen receptors in our inner ear, I think. The Mayo Clinic confirmed it after my mom did a little bit of research, because every doctor I talked to was like, I don't think there's estrogen receptors in the inner ear, but according to the Mayo Clinic, there is. So, for example, if your estrogen goes low, which mine has, based on the blood tests, it could disrupt your inner ear, which controls like your sensories and your gravity centering and all that, stuff. I don't have the medical terms, okay? I'm a chef, I'm an actor. But I still think, so my vertigo got really so bad to the point where I needed to go to the emergency room. I went to the emergency room. It was very, very debilitating. It was very hard to be there because I would be checked out and then sent back to the waiting room, checked out, sent back to the waiting room, and it was awful because everything was spinning so much. Like, I had to sit with my head in my hands and my eyes closed, and eventually I did throw up because it was just making me so sick. Like, I couldn't walk. I had to like hold on to walls and stuff. It was so bad. And I hate hospitals. I don't like going to hospitals. So, for me, if I go to the hospital, it's really bad. And it was hard because my little 6-year-old daughter was there, witnessing all of that, which, you don't want to scare your kids, right? So eventually they checked my heart. They did a CT scan looking for brain tumors, did blood work. They did that vertigo test. I always forget the name of it. And everything came back clear. Thank God, there's no brain tumors or anything like that. They did find a nodule on my thyroid, which I had checked out. That's good too. Not sure what the point of that was, but basically sent home with nobody really knows what's going on. Maybe there's a infection or something, not really sure. Here's some medication, hopefully it works. Antihistamines and steroids. So since then, I've seen my OBGYN, I've seen my doctor, I've seen an ENT, I've seen a vertigo specialist, and still nobody knows what's wrong. The next step is to discuss some HRT treatment with my OBG. Now, we did do 10 days of progesterone on and 10 days off to see if I still get a period, because that's how you sort of determine if you are menopausal or not, or if you're capable of getting pregnant or not. Which sadly, we were maybe going to try for one more baby. But my OBG, after seeing me and seeing my blood tests and stuff, says it looks like you're pretty much out of eggs. It's been a very frustrating journey. I still have the dizziness and the hot flashes and exhaustion. It's frustrating because everyone I spoke to said that you're too young to be in menopause, it can't be menopause, um, and all the specialists. This is the specialists. Even when I spoke to my OBG, she said yes, you are, but she still said that vertigo isn't a typical symptom. But I've had everything else checked out. It only makes sense to me that it's that, right? So I think the next step is for me to try going on estrogen. Like I said, I did the progesterone for 10 days and I felt insane. It kind of reminded me of when I was pregnant with my second daughter. So just so you know, if you're going to go on estrogen, there's a possibility you could be, progesterone sensitive. And I think I am, because it made me feel like anxious but exhausted at the same time. It was awful. I was so mood swingy. Like, my mom's like, you even looked different. I just was not happy taking oral progesterone. I know there's other ways of taking it, but if you have a uterus and you decide to take estrogen, you have to take progesterone to protect your uterus from endometrial cancer, because when you take estrogen, it thickens the lining of your uterus, therefore making you more prone to cancer. So I know there's a lot of fear around HRT causing strokes and breast cancer, and I know that there was a lot of, there was that one study that was done that went sideways and created that whole pandemic of women throwing out their hormone pills, which was a big mistake, because so many women suffered with mental health, heart health, bone health, because they weren't taking their hormones. I know it sounds kind of contradicting when I'm just saying like you need to take one hormone to counteract cancer from the other hormone, but it's different. It's hard to explain, but thank God there are lots of awesome specialist women, physicians of all sorts that are doing the research, finally doing the studies, speaking up and bringing awareness to menopause and normalize talking about it. And that is why I am here, to normalize talking about menopause. I'm lucky that I'm going through it because I can teach my two daughters what to expect and normalize talking about it. Normalize talking about your period, normalize talking about, like, if you get your period at a younger age, you're going to run out of eggs earlier, from what I'm learning. And that makes sense, because I was just shy of 13 when I got mine, So, and even I learned, like, when you're in your mother's womb, you're going through eggs. And as soon as you're born, like, you're still losing eggs, even though you don't have your period. So for me, it's like, I never thought I'd run out, but it looks like I maybe have. And that's something to think about. I know there's a lot of talk about freezing your eggs when you're younger, when you're not ready to have babies, so that you can choose to have babies when you're ready, when you're older. So even with the awareness that I have and the amazing doctors I have, I still got that pushback. I still got that, like, I felt like I was screaming and no one was listening to me when I'm saying I am in menopause. I'm pretty sure I am in menopause, and multiple doctors saying you're too young and that's not possible. When all you have to do is a blood test and look at the results, and it's right there. Like, my FSH, I think it's FSH, is high, and my estrogen is low. And hot flashes, I think the only other way you might get hot flashes is from some other illness. But other than that, hot flashes are the number one symptom of perimenopause or menopause. It's literally like premenopause, perimenopause, menopause, postmenopause. I don't know.